Thanks, Tina. It is important to have healthy teeth, of course, and we all know about brushing and flossing every day. But sometimes things happen and teeth can be lost either through an accident or decay. So how can they be replaced? Well, many people choose dentures, but there are alternatives, and this morning we are exploring the options you may need to consider someday. We're joined by Dr. Al Kwang Hing of East Coast Dental Insuro, along with dental patient Tony Coffey. Good morning.
Good morning.
Now, Tony, I'm going to start with you because you had an experience with dentures. What happened?
Well, through years of really not so great care and nutritional issues, I eventually lost my teeth at a young age. Had to take all of them out. Ended up with dentures at the age of 31. And for about 11 years, I struggled with just about everything in life.
Yeah.
Where regular people would be at an event to enjoy the evening, my entire event would be structured around where's the public washroom, who's going in, who's going out, will I have enough time to put denture adhesive on to make sure that I'm not losing my dentures halfway through the meal or halfway through a conversation. So.
Right. And you had upper and lower.
Upper and lower,
is that
yes.
Right? Okay.
Yep.
So then you went to East Coast Dental, and what were the issues, Dr. Al, that you found Tony was having?
Well, a lot of the issues resulted from Tony having some treatment done before, which didn't work out. So the biggest thing I had to overcome was his poor experiences before. I had to really spend a lot of time debunking things for him. And I said to him, there was such a divergence in what I was telling him and what he had experienced that he basically looked at me and go, what are you talking about?
What are you talking about?
Yes.
Yeah.
So it became a conversation of, okay, let me go through things with you, let me prove things to you, let me have you talk to patients that we've treated successfully, to make you realize that what you are experiencing is not unique, and what we've done to help these people out. And when you have a frank conversation with someone who has actually gone through this whole experience and had a great result, then that gives more reassurance than myself, because I've never had it done.
Now, for anyone out there who has dentures, because a lot of people do have them and maybe don't talk about having them.
Nobody
I mean, you probably didn't, broadcast it.
No, I thought about buying ad space on television and advertising, but it just didn't seem to come to mind.
Didn't seem right. No.
Actually, most of my clients had no idea that I even had dentures, because you just sort of suffer in silence.
Yeah.
It really is, from a self-esteem standpoint, it's not something that you're going to discuss at any given time. So now that I have real teeth, just like you, pretty much, I wanted to do the commercial. I was happy to do it, and I really feel like the biggest adjustment for me is actually being adjusted to being normal again. Yeah. Not having to worry about things ahead of time, just living.
You can just exist without having to think about it, which is nice. So, Dr. Al, what does Tony have?
Well, what he has is implants on the top and the bottom, supporting a set of teeth that are fixed to the implants.
Oh.
So what?
Like that? Is that what you have, Tony?
So what we have there is what's called a bridge. And that's what's actually fixed onto the implants. Huh. Tony can't remove it, but we can if we have something break or we have an issue with cleaning. But what he has is something that looks, feels, and works just like his real teeth. He'll feel everything except hot or cold.
Huh.
But because your gums and your bone do have nerves in them, eventually you develop some compensating factors. So you will feel hot and cold now, eh, Tony?
Eventually.
And the great thing about it is 50% of the taste comes from the roof of the mouth. So if you're wearing a full top denture, you don't taste food as well. So that's a huge impact.
So this is called an implant, is that right?
That's actually called an implant-supported bridge.
Implant-supported bridge. Now, how long does it take to get something like that put in?
Well, this is the unique feature of what we do. We actually will place the implants and have the person leave with a temporary set of fixed teeth. Yeah. So they come in wearing a denture, and 4 to 6 hours later, they leave with a set of teeth. Now, they'll wear these teeth for a period of 4 to 6 to 8 months, and basically, during that period of time, they use it to test drive them. So they'll give us feedback on size, shape, color, positioning, what the bite is like. And we work with that and adjust it, because when we make the final set, obviously, you want to get it right.
Right.
And that's what the process is. Actual fact, Tony, you went through more than one set, because when you're wearing dentures, things just don't fit. So your bite's off. You know, you're trying to have things fit together, but they're not.
Wow.
So Tony's had everything done step by step. And the beautiful thing too is this is part of that, that divergence. I said to him, Tony, when you leave the office, you're actually going to leave with a set of teeth you won't take out.
And
he goes, no, that can't happen.
Yeah.
This is not going to happen.
Like just this past Sunday for Father's Day was the first time in about 15 years I ate corn on the cob. And I ate it with the rest of the family. I was the first one done. That was the best part of the meal, just to be able to do that and not worry about the teeth popping out of the table.
And do you just clean them as normally, like brush and...
Actually, I'm easier with a simple water pick. I get everything out that I need. Oh. Everybody else at the table is worried about they got to floss every individual tooth.
Wow, it's amazing that you can have dentures and then walk out with teeth. Things have come a long way.
They really have.
Yeah. That's amazing. It's like art.
Even really. From the time that I started my process, this really didn't exist. The all-in-one system and everything on site in one location. For my first treatment, it would have been multiple locations. This is the big advantage of going to East Coast Dental Center, is that everything is on one site.
That's amazing. Well, I thank you both for coming in and explaining all of this. So great to see that this kind of thing is possible now. Yeah. So I appreciate it. They look great. Look at that big smile.
Thank you.
All right, well, we're going to take a break here on CTV Morning Live. We will be back in just a few minutes. Stay with us.